Welcome to the office. After giving birth, it's been 3 months.
Yes, almost.
Yep. And you're saying you feel that your hips are wider?
They are definitely wider. I can measure and visually see.
Okay.
But more importantly, I feel dragged down by them.
Dragged down meaning you don't have the power to move them?
I do. They just feel heavy.
Heavy. So
Yes.
they feel heavier after pregnancy.
They feel heavier.
Okay. And you're familiar with the whole process, and it's a basic thing about the hormone relaxin, right? So during pregnancy, there's a hormone relaxin, and it relaxes the ligaments, it opens up the pelvic cavity to allow for delivery of the baby. After pregnancy, what happens? The hormones start to go down, and the pelvis should start to come back to where its original state before pregnancy was.
Gotcha.
Yeah? Okay, how was pregnancy?
Not bad at all.
Not bad, smooth?
Very smooth.
Delivery time?
Like
On
how
time?
long? Yes, on time.
On time. Normal birth, vaginal birth.
Yes.
Okay, epidural,
Yes.
epi, L4, L5.
Yes.
Okay. All right. Now, what you've seen anybody for this? Did you talk to your OBG and say why does my pelvis feel heavy?
No.
No. Okay. I'm just curious. Just
Okay.
asking. Okay. And that's the number one reason we're checking you today.
Yes.
Okay. Any other issues going on?
I've been having prenatal and postnatal Pilates class.
Okay.
And after delivery, I feel like one leg is shorter or longer than the other.
Which leg do you feel off?
Maybe the right leg is shorter.
That's what you feel.
I know they're not the same length, but I think this one could be shorter.
Okay. And is there less power on that side?
No, there's more power.
More power on your right side.
Yes.
So the hips feel heavier. I'm just trying to, the hips are heavier, but the right leg feels shorter, but there's more power on the right.
There always has been more power on the right leg. It's also thicker than my left leg.
Aha, okay. So this is good information. What did you do before? Before
When I was
pregnancy
very
birth?
young, I did dancing, like ballet and stuff.
Okay.
And I used to stand more on my right leg, so it's stronger. Even now, I can hold more, longer on my right leg alone.
This is your pivot? You would pivot on your right?
Yes.
Any injuries? Do you remember any injuries?
No.
Any high school sports? What did you play?
No sports.
No sports, just ballet was your thing?
Just dancing, and they stopped in high school.
Okay. And no activities in high school, college?
No.
Okay, just studying?
Yes.
Just study. You sure you're gonna keep her?
Yes.
All right.
Oh, one more thing.
Please.
My ribs, they have always been going.
Protruding out.
Yes, protruding, and the left rib especially. It's visually obvious, and it's not pretty, and I don't think it's very healthy. It just feels.
So the left side feels like it's coming out more?
Yes.
Okay, I'm going to explain where that's coming from today. Okay?
I'm asking doctor. Also, I noticed she seems having anterior pelvic tilt, and she couldn't quite hold her core, so the whole core and the rib cage is going out, and the butt is up.
Yeah.
All right, I'll go over your x-rays. I'll explain what I see. After that, we'll do the exam.
Okay.
We'll figure out where we're going to start today. We'll see for a few visits, and we'll see what we can do.
Sure.
Sound good?
Yes, thank you.
Number one, we're looking at posture. And the first thing we can see here is if I run a posture line up, your upper body sits behind your foundation. So it's not so much that you're telling me you have that pelvic tilt, it's this. It's that you're back like that. I'm exaggerating, okay? But she's behind, so the upper part is slightly behind, and then the neck has to compensate. We'll talk about the twisting. So it's not so much that this is an anterior pelvic tilt, it's that the upper body is slightly behind. Okay? So that's the main difference, or the main thing I want you to get in terms of pelvic tilt. And the first really good news I want to point out here is her Blvd. You know, I talk about digestion a lot, you hear in my videos. And this is a normal Blvd. You're one of very, 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 very few people that have it in my office.
What's that? Megan?
So this is the gastric air bubble. This is the size it should be. This thing here,
It's a bubble.
it's an air bubble in the stomach.
Oh.
Most people have a little tiny one I see. It's supposed to be big like this. And this is almost a textbook example of what it should be like.
Interesting.
We do have a little bit of digestion issues going on here, but it is not coming directly from the stomach as I see it today. Okay, that's the good part. All right, now let's go over this. We can see what? What do we see here, Lily? We see the foundation. We see some curvature in the spine, right? And we can see it tilts to the left, it compensates back to the right, tilts again, so it's kind of like a little S shape. I'm going to zoom in now so we can look at the foundation. And let's see if we see anything going on here. Does this look symmetrical? Here's the pubic bone here, here's the crease of the bum here. Does it look symmetrical? It looks a little bit off, right? Let's look at the numbers and let's see what they tell us. The good part is this, even whatever's going on here, the base or the femur headline here, the measured difference is 1, okay? If I correct your pelvis, the actual difference becomes 2, that's still fine, I'm okay with that. But I do want to talk about this, and there was some injury in the low back, and I'll tell you why I say that. I don't think that was from pregnancy. I don't think. AS2EX6, and then we have a drop sacrum 3 millimeters on the left side. So there was something did happen on this left SI joint. And this is what I'm talking about here. So I'm going to talk about it this way. Your left SI joint. The way the SI joint moves, it's based on the shape, and I do want to talk about this so you understand. The SI joint is what we call an auricular surface, right? It has just like the auricle of the ear. It's not perfect angles. It has that curve to it. When it moves down, when it goes down, it naturally wants to go out. When it goes up, it naturally wants to go in. Your misalignment of the left side goes up and out. That tells me that something did happen there. Okay? Now, we also have a drop sacrum on the left side. And it's down 3 millimeters compared to this right. Now let me put it together in my hands and show you. It's doing this. The left pelvis goes up and out. The sacrum goes down. That's the issue that needs to be resolved. And that's what's starting this S-shaped curve. Okay? You said you feel like you have a short leg, right? It's not actually that significant. What you're feeling short is your sacrum. I'm going to talk about that, and when I do the exam, I'll show you, okay? Let's go back here, and I want to talk about the twisting you're feeling. Now, we did say in terms of digestion, her Megan Blvd is good, but if we look here, this is a lot of undigested food in the colon, okay? Unless you had a really big meal the night before.
Not quite.
Okay, I'm not going to need to give you anything for that, but you'll tell me if anything has shifted in a couple of adjustments in terms of your digestion. Now, let's look at the vertebrae and let's talk about your ribs. This is important. So, if we look here, we're looking at it curves from left it goes right. What we want to look at is the circles here, okay? And the shape of these circles are going to tell us which way the rotation of the spine is. So if we see the circles are bigger on one side versus smaller on the other, do you see that?
Yes.
So let's look here. This is bigger, this is smaller. Yes? Bigger, smaller, right? So what it's telling us is this. It's turned. So if we look at the pedicle shadows, it's doing what? It turns, and it's turning to the left. So the right pedicle will appear smaller, more to the periphery. The left will appear larger. But then what happens at the top? Do you see what's happening? It shifts. So when we look over here, bigger, smaller, bigger, smaller, bigger, smaller. What happened there?
They switch.
It switched. So you're mid-back, and that's the area that controls some of the digestion. So it's not that I need to give you anything for it, but I'm showing you that your middle back is compensating.
Mm.
There's an abrupt shift in the rotation.
Mm-hmm.
And that shift is happening right here in this part of the back.
Mm-hmm.
Tender in there?
Yes.
Yeah.
Mm-hmm.
And that's compensating. So what are those muscles trying to do there? They're trying to tighten up to hold you in place.
Okay.
Does that make sense?
Yes.
Let's continue. So the main take home here on this x-ray is what? Is we have the foundation off, and because of the foundation it's causing some twisting. This twisting is what you're feeling in terms of the compensation all the way up to the neck.
Mm-hmm.
Let's go over your side profile and I'll give you the good news too today. The low back curve is decent,
Okay.
okay?
Yes.
It could be a tiny bit more, and that will come from the left pelvis adjustment.
Mm-hmm.
But then what happens here is what? It goes back and then it kind of stays back. It doesn't round forward. That's what we
Okay.
need to work on.
Okay.
And as a consequence of that, what is the neck doing? Let's zoom in. So it wants to have that curve, you see?
Mm-hmm.
But then what happened there? You didn't have a whiplash, you're telling me, right?
No.
Okay. So what happened at this part of the spine? It's kinking forward.
Right.
It's compensating. So I'm pretty sure you get pops and cracks and that tightness in the middle of your neck.
Mm-hmm.
That's where that's coming from. Okay, so the take-home message here is this upper neck is compensating because of the posture.
Mm-hmm.
Now let's go over your discs. Your discs are all good, okay?
Okay.
I'm good with all that. 5 is good, 4, 3, 2. But what I do want you to see is this, and it's part of our answer. You see how it's tilted a little bit. These should all be parallel, like this.
Oh.
This is tilting more, tilting, all the way to here. So this whole 5, 4, 3, 2, 1, 12 levels off. So L1 through L5 is all compensating from your sacrum.
Mm.
So the issue is not in your lumbar spine,
Okay.
it's compensating from sacrum. 12 levels off, 11, and the mid-back is going to come from right around where you're complaining of that rib.
Mm-hmm.
Around 11 or 10, similar to yours. Okay? So in neutral, we want a forward curve, we said.
Mm-hmm.
In extension, you see how they all line up?
Yes.
That's how they should be in neutral.
Oh.
Okay? Now, here's our answer. In flexion, they should all move forward, yes?
Yes.
2 move, 3 move, 4 move, 5, 6 kinda, 7 didn't move, did it?
No.
7 still stuck back.
Mhm.
Maybe T1. So 7 T1 is a potential, the base of your neck, the sacrum down low, the left pelvis. I'm just putting some pieces
Right.
together, okay? Sacrum for sure, sacrum pelvis, C7 T1. Whatever else we find in between.
Okay.
I don't want to be messing around with any of this. This is all compensation.
Okay.
If we get something in the T11, T12 area, I'll deal with that.
Mm-hmm.
Meaning if I get something in here, I'll deal with it. Okay?
Mhm. Yeah.
Does that make sense what I'm saying?
Yes.
Okay, any questions on the x-ray?
No.
You ready to get started?
Yes. Thank you.
Cool. And the first thing I can already see here is, look, this is swelling of her sacrum. I don't really see her dimples. You see her dimples
It's
in
not
it?
fat, it's swelling?
That's not fat. Okay, big misconception.
Okay.
This is inflammation. So we're probably going to do the tailbone. You can see this erector is bigger. This is smaller.
Yes.
You can see this goes forward. Yes, I agree. This comes back. You see the difference here? This is more pronounced. This is
Yes.
less pronounced. Shoulder is more pronounced on the right than on the left.
Mm.
All right, so let's watch the dimples. They should move up and down. And where are you from again?
Shanghai.
Shanghai? Let's see if you got that Shanghai wiggle. Let's walk for me, please. What'd you think, Wayne?
It's not moving. Nothing
Okay,
moves.
you're gonna walk to the end, turn around and walk back. She got the Shanghai wiggle.
Do I?
Yes, you do. Just walk back and forth several times. Can you raise your pants up a little bit so I can see your ankles from the bottom? Please? Thank you. Bueno. Just regular walking. She compensates by pronating the right foot. I'm just talking stuff out. Alright, so yeah, you definitely got that wiggle. You walk side to side. instead of through the joint. And that's what we want to change today.
Okay.
So when she's walking, you can see she pronates her feet. You see how they go in like this on the inside. And that's a function of this. So you actually walk like, I'm making fun a little bit. You actually walk like this.
Okay.
Okay? And then when you walk, your feet do this. They pronate in. When we step, it should be a step on the outside edge and a toe off. So you're not getting the right toe off, you're actually toeing off from the inside arch. Check it out. Let's do it again. Regular walking. So when you watch, she's not translating from the transverse arch to the big toe. What she's doing is she's pushing off from the navicular to the big toe, the medial arch. Okay. Got it. Have a seat over here. Let's get started. Starting at the base of the neck, let's see what we got. Watch this, Wayne. It looks like it's going to break.
Wow.
But it doesn't break. You see that?
Yeah.
This is all compensation. And you can see, look, this is her upper body. This is the foundation. Look. Get from the top. You see that?
Yes.
You see the discrepancy in my hands? This is above, this is there, this is behind the foundation. This, bring your belly button in and up. This is where she should be. This should be her normal posture. Okay, relax, whatever's comfortable. Got it. So, left side. Doesn't stop though, Wayne, until where? Somewhere between 10 and 11. And there it is. S3, S4, left side, 6 points. 10 points. I get a lot of patients, especially female, that they think this is fat. And so they try everything to try to get rid of that and work it out, and that's just inflammation because of the alignment of the sacrum. So we have S3, S4, we have T around T11. Let's check the neck. Head down, please. Good. Look up a tiny bit right there. C7, 12 to 15. 15. C7, T11, maybe 12, and S3. Open and close the knees with your feet touching. Open wide and close. Open and close. Good. Right side only, please. Left side only. Subtle. When she does the left, the right is completely fine. Do the right side. When she does the right, it's at the very end range. I feel the pull here, all the way to here. Do the right side. Open. Right side. Right side.
Oh, sorry.
Left side. Nothing, no action here. This is all good. It's when she does this side, this whole thing wants to shift. That's where all the swelling is. Right there. It pulls all the way into tender, yes?
Yes.
Right there. That one more tender. Ooh. Or that one more tender.
The previous.
That
Yes.
one, yes. Head down, please. Let's count. Round your back slowly. Good. 2, 3, 4, 5, 6, 7, 9, 10, 11. Okay. Back slowly towards me. Let's go back in extension. That's 5. Tender.
Yeah.
S1.
Ah, yes.
More tender.
Oh, same.
Same tender. S2.
Same.
Hey.
Not much of a difference. Oh, it's okay. This one's a little better. Also tender.
That's tender.
Yeah.
More on the left side, more on the right side,
Left.
or the center.
Center.
Right there. That's S4. Okay. That's 3, 2, 1, and then 5. Okay, 5, 4, 3, 2, 1, 12, 11. 12 more tender?
11.
Or 11?
11.
11, S4. Let's check the neck now. So she's compensating by more movement, hypermobility in the upper neck. That's why you're getting this tightness right here. You feel that? But it's not moving down here. But it looks like it's moving because it's compensating up top. Do you feel what I'm doing here?
Yes, yes.
Yes. Okay, I don't want to go harder than that. So here's our game plan, okay? C7, T11, S4. Yes? You ready?
Yeah.
Let's do it.
Okay.
All right, we're gonna go through all the way. Chin up, please. Slide down a tiny bit. There you go. Good. You got her? Now we gotta torque. Home run. Like butter. Hi. Nice. Sorry. You okay? Walk it off, please. Not bad, huh?
Not bad.
Not bad. Walk it off 2 times, please. Back over here. Have a seat. Let's do the neck. C7. C7 we're going to set as a PLS right on the left side. Hands on your lap. Good. Left ear down. You are super flexible. So with that is we have to stabilize with the stabilization hand and follow it through. Left ear down. Gotcha. Home run. Hi.
Hi.
How's it going?
It's
Raise
good.
your right hand. Walk it up. Good stuff.
I feel different. I don't know how to describe, but it's different.
Hopefully different good.
Different light.
Different light. All right, now we got to do the B button, T11. T11, we're going to set it as a PR-T. I need you to drop it down all the way. All the way down. Good. You okay on the shoulders there?
Yes.
A little bit more, please. Drop it down. Down. Gotcha. Home run. That was tough, but we got it. Come off slowly, please. Hold a hand if you need it. Perfect. And you're going to walk back and forth. Hi.
Hey. I feel taller.
Walk it out. Good. She got a good facial expression today. Hi.
Hi.
You're welcome. The right foot's not pronating. Now it is. Go back, go slightly to the right a little bit. Yeah, and now walk this way. Walk on your toes. Up high. You wear high heels? Do you wear heels?
Not very frequently.
Walk on your heels now. Come back over here. Turn around. Let's see the back. Voila! Come here. A little less. Walk, please. Let's get a tiny bit more of that sacrum. It's good, but I think we can get a little better, okay? Cool. Let's go left side down. I'm gonna do involved side down. Opposite torque, left side down. Over here, please. Cool. Misleading. Misleading. Last one. Bottom leg straight, top leg bent. Slide your whole body forward. I got you from here, okay? I won't drop you, I promise. Hold here. Hold your wrist. Look straight ahead. Down. Nice and easy there. Shoulder up. Shoulder up. Stealing my thunder. Relax there. Let's roll it forward and we're going to torque up. There's the rest. Ah! Walk it out. Nice. All better?
Very light.
Very light. One last time, walk on your toes, please. Back over here, have a seat. Let's rescope. Good stuff. We did C7. We did 7, 11, and ooh, nice. Check this out. Check it out. A little different?
Yes.
A little different to sit, ma'am? Cool. Seven is clear.
Mm.
11 is clear. 7, 11. Sacrum is clear. Check it out. Back slowly towards me. That's 5. Different?
Yes.
That's the 1, remember?
Not so painful.
Remember 2?
Yes.
You remember 3?
Yes.
4.
Mm-hmm.
Good stuff.
Okay.
Now let's tune up the rest, okay?
Mm-hmm.
Ears. Right shoulder. Let me do the work. Down, down. There. Relax the shoulder. There you go. On your back, please. Let's work on your ankles. Raise your left leg. Right there. Gotcha. Sit up and turn, please. And now let's do the buff and polish. Very good. How's that rib feel on the left side?
Physically?
Any different? You'll tell me more next visit when
Okay.
you guys see, but I don't know if anything feels different or not.
It never felt out of place. It just
Just look like it. Okay, so you'll tell me next visit.
Okay, I will.
Squeeze. Squeeze. Elbow. Posterior ulna. Posterior lunate. Posterior lateral scaphoid. Let it go. Squeeze. Posterior radial head. Relax it. Posterior ulna. Posterior lunate. Go like that 5 times. Squeeze. Good. Squeeze. Questions for today?
No.
Welcome to the office.
Good doctor. I
You
feel
got
great.
it. Awesome.